Hopefully everyone can see that. Okay, so welcome everybody to the CEG Tower Hamlets LEV update for 2024-2025. My name is Toyin Omisore and I'm the primary care facilitator for Tower Hamlets. Joining me today is Faye Wilkins and she's the senior primary care facilitator for Tower Hamlets and Waltham Forest.
Toyin, sorry, you're on mute.
Sorry everyone, I'll just start again. So welcome everyone to the webinar. My name is Toyin Omisore and I am the primary care facilitator for Tower Hamlets, and Faye's also joining me today and she is the senior primary care facilitator for Tower Hamlets and Waltham Forest. So this is what we'll be covering today. I'm just going to give you a brief introduction to the CEG, just in case some of you don't quite know who we are. Then I'm going to go through your local enhanced services update. I'll talk a little bit about the ICCQ enablers and the Apple Renal tool. And then I'm going to talk to you about our data quality accreditation incentive scheme. And then I will tell you what the CEG can offer to practices. Okay, so the CEG, which stands for the Clinical Effectiveness Group, we are a non-for-profit organisation based at Queen Mary University of London, and we have worked in East London for over 30 years, and we work in partnership with the NHS primary care teams, supporting them with quality improvement. We're a team that's made up of GPs, analysts, data scientists and facilitators like myself, and we build searches, templates, documents, protocols and dashboards for GP practices, NHS commissioners and public health. We support around 272 practices across the 7 boroughs in North East London, and we have at least one facilitator for each borough. Okay, so I'm just going to go through the LEV updates for 2024-25. So that's going to be updates in integrated care and your ICCQ enablers. For the rest of your levers, there's not been any changes for this year. So they've basically rolled over from next year to this year, but I will give a brief recap. So starting off with integrated care. So indicator CP1, which is cognitive assessment. So you're supposed to ask eligible patients if they have any memory concerns. Now, the list of eligible patients, so it's not everyone that you need to ask. It's mainly older patients, so sort of 60 years and over, who have an LTC, but the full eligibility list is in the LTC template and also in the integrated complex care template on the dementia screening and assessment page. So if the patient says they don't have a memory concern, then you simply need to code no problem with memory. But if they do express that they have a memory concern, you need to carry out an assessment. So this can either be the 6 cognitive item test or the GP COG test. And both of these are on the dementia screening and assessment page. So DIAB 2 indicator, so this is for type 2 diabetic patients with retinal screening in the last 12 months for those with retinopathy, and in the last 24 months for those without retinopathy. So the payment code is the same, digital retinal screening. However, you may already know that the eye screening service since last October, so October 2023, up until this October 2024, they are gradually putting patients on either the 1-year recall pathway, and that's for patients who have retinopathy, or the 2-year recall pathway, which is for patients who are low risk, meaning that they've had 2 consecutive no retinopathy results. Although, if a patient subsequently has a retinopathy result, they will be moved onto the 1st-year pathway. So the search for this indicator is currently being developed, and once it has been completed, we will let you know in our CEG bulletin. Okay, moving on to RESP 1. So this is for COPD patients with a COPD assessment test in the last 12 months. So the payment code is the same, chronic obstructive pulmonary disease assessment test. But this has moved from a monitoring metric to a payment metric. And so now the target is 75%. Okay, so the COPD with FEV1 of more than 50 prescribed any inhaled steroids, this is on pause and is being reviewed currently. And the metrics COPD and have had FEV1 and MRC score within the last 12 months has been removed for this year. Renal ones, so CKD patients with the latest BP of less than 140/90 in the last 12 months. So the diabetic portion of this indicator has been removed. So last year, if a patient had both CKD and diabetes, their BP would have to be below 130/80. But the diabetic portion has been removed for this year, and the target has been raised from 40% to 60%. For the renal 2 indicator, it's CKD patients with an ACR of more than 70 will need a BP of less than 130/80 in the last 12 months. So last year, it was just that you needed to do an ACR, but this year, if the ACR is greater than 70, their BP will need to be below 130/80. But this metric stays as a monitoring metric. MH1, so antipsychotic monitoring for patients on antipsychotic drugs. So last year, you simply needed to code the antipsychotic medication physical health check code. But this year, as there is 2 new elements that you need to record, so that's waist circumference and pulse rate or rhythm, you will also need to include BP, the BMI, and the annual blood. So these 6 things need to be included for you to satisfy the indicator. However, if a patient does refuse to have their waist measured, you can code waist measured decline, and this code can be found in the LTC template on the mental health page. Okay, so other changes. is to do with an increase in the target. So for smoking cessation advice offered, which you have to do for your LTC patients and your complex care patients, the target's increased from 85% to 90%. CVD4, so your AS patients who are on anticoagulation with CHA2DS2-VASc score of 1 or more or not recorded, that's raised from 90% to 92%. And CP5 is an action plan for children with asthma only, so that's raised from 55% to 60%. Moving on to your ICCQ enablers. So for access digitally excluded, it is basically the same parameters as last year. So what you need to do is contact patients with no mobile number recorded. And for those who are digitally excluded, you need to ensure that they are aware of alternative ways to access practice services. So the patients that you contact this year will have to be new and different from the patients that you have contacted for the past 2 years. You should also exclude contacting your LTC patients, as their communication preferences will be recorded as part of the wider determinant questions that you asked during their annual review. The code for this is education about access to patient-facing services. And there is an additional requirement, and that's for specific learning sessions to support patients on how to access GP services via digital access. There is a support search for this. It's the ICCQ Digitally Excluded Support Search, which you can find in the CEG domain in population reporting. Okay, moving on to the young people's enabler. Again, they are the same parameters from last year. So what you need to do is send a letter and a leaflet to young patients on their 14th birthday. You can find the letter on EMIS called Young Person Turning 14 Years Letter. And the letter explains to the patient how they can access local health services, that they can be seen on their own if that's their wish, and that they have the right to confidentiality. The code for this is patient in local audit, but this code is attached to the letter, so it will automatically record on the patient's note when you save the letter. There is also a support search for this, so ICCQ Young People Enabler Support. There are other requirements that you need to take note of. So you are required to send out an accurate e-version asking specifically for 14-year-old patients' up-to-date contact information. You need to ensure that your young people's rights for confidentiality policy is up to date and in place. You need to provide evidence that your website outlines the basic rights for young people in healthcare. You also need to give evidence of visible information in your waiting rooms and on your website for young people's services. You also need to provide evidence that you are listening to young people. So this can be in the form of feedback and comments via CPG or surveys, and also feedback from your welcome training. Staff will need to be trained for the C card training home come correct. So that's the free and confidential service that offers free condoms and sexual health information and support to young people aged 13 to 25 years of age. You will also have to provide evidence of that you are updating contact details of young people regularly, and you also need to actively promote the NHS app. Okay, so you also have an enabler focusing on the renal elements in alignment with the London Kidney Network by using the Apple Renal Tool. So the CEG Apple Renal Tool highlights critical falls in renal function and helps practices to manage their patients with early or late chronic kidney disease. So the tool picks up patients who are adults who have ever had a EGFR reading of less than 60 or an ACR reading showing proteinuria of 3 or more. And on the tool, there are various filters that you can select to help you display specific patients that you want to focus on. So we are aware that there has been some confusion around the indicators and versions for this enabler, and the ICB are currently reviewing this. The CEG support material that was published last week, Monday, has been recalled while we are waiting for more clarification on this, and the ICB will be sending out comms about this soon. And I also just want to point out that the previous trigger tools are no longer active, and they haven't been active for some time. So it's our Apple tools that have replaced the trigger tools, and I will briefly go over some of the other tools, other Apple tools that we have later on in the presentation. I've also put some links on this slide. So one of the links is to our website page dedicated to information about the Apple Renal tool. So you can see the webinars that we have done for the tool. And the bottom link allows you to make an online request to download the tool. Are there any questions for this portion of the presentation?
So we have got one in the chat, Toyin.
Okay.
So one says, can you please clarify mandatory optional areas on the APL renal tool? There are also contradictions between the enablers document and the guidelines.
Okay, so the first part of that, sorry, can you just say the first part of that again?
Can you please clarify the mandatory optional areas on the APL renal tool?
There are no mandatory or really optional areas on the renal tool. The tool is created to bring all of your patients who have maybe a renal impairment so that you can focus on the patient that you want to focus on. There's no optional or mandatory patients that you have to look at. It really is for your clinicians to decide which patients to focus on. In terms of the enabler, there are, I believe, 4 indicators, but as I said, they are going under review, and the ICB will be sending out comms about this because there has been some confusion about exactly what the indicators are. Was that the only question so far?
So as you said, I think this is referring to the detection and optimization part of the enabler spec. Do you want to just come in and just clarify what you're meaning? Sorry.
Hi. Yes, if I may, please.
Okay.
Toyin, in
Yep.
the guidelines, the latest ones I've seen, there is one area out of the 4 which says clearly optional. And when you look at the enablers, you will see that the devices detection areas, optimization areas. And that's what's creating the confusion. If we look back at last webinar when John Robson released the new tool,
Yeah.
there were no guidelines as such, but we took back his recommendations and he gave us 3 areas of where we should focus on. And if we had time to spend on the tool, then we could expand and explore more. So I think this is where we need really to be clear about what we need to submit to the CEG.
Right. Yes, as I said, there has been quite a lot of confusion. The ICB are going to release some comms soon about exactly what the fault indicators should be and how you should report it. So I'm sorry, I can't say anything
No
further
worries,
than that
no
because
worries.
it's sort of up in the
Yeah.
air. But
Well,
yeah,
hopefully that would do for the next quarter because we're already working on our submissions for this one, and
yeah.
we are going on what we are understanding these
Mhm.
areas are. Thanks.
Okay, then we have another question. Can we still use the tool for the falling EGFR trigger, excluding part B, GFR less than 60 and ACR more than 3 and not coded CKD for now?
I think you might be referring to the support material that was published last week. As I said, it has been recalled because there has been questions over exactly what the fault indicators should be. So I don't want to say too much more because the ICB are going to have more clarification on this and they're going to release comms about it. I did recall that support material when it became clear that there was questions over what the fault indicators should be. So I'm sorry, I know that's not very helpful, but we are going to have to wait to see what the ICB comes up with. Are there any further questions?
That's the last question in the chat.
Okay. Okay, I'm going to move on now. Okay, so here are the list of some of your other local enhanced services. I'm just going to give a quick recap. So as I said at the beginning, there have been no changes for this year. So they've just rolled over from last year. So for latent TB, just to let you know that the template to use for this is RP Health Check. So there is a latent TB page, and there's also the latent TB screening support search. For NHS Health Checks, it's the same template, so RP Health Check, but there's a specific page, NHS Health Check page, and there is also the support search, NHS Health Check support searches. And for sexual health and LARC, for sexual health, the template to use is RP Sexual Health, Town Hamlets. And for LARC, it's the RP Women's Health template. There are also support searches for this, and it's the sexual health and LARC support searches. Okay, so for substance misuse. Again, it's the same as last year. The template to use for this is substance misuse and alcohol. And there is also support search, substance misuse NIV support. For surgical aftercare and wound care, I do just want to explain this a little bit further. So there's two parts to this. There's the surgical aftercare part, which is for patients who need wound care after they've had secondary care intervention. So this could be wound dressing or removal of sutures and clips. And then the second part is minor injuries, and this was introduced last year. So this is for patients who need wound care, but who have not had secondary care intervention. So it's for minor injuries such as head lacerations, grazes, splinters, minor burns, skin flap cuts, etc. So these injuries have not come about through secondary care, and you feel that you can treat them in primary care, you will get payment if you code consultation for minor injury. So there are two different templates that you can use for this. So there's the RP surgical aftercare template and the RP practice nurse wound care template. Okay, so now we're moving on to the data accreditation and improvement incentive scheme. So this is a scheme that started last year, and it's jointly commissioned between the CEG and the now ICB to support practices with recording good quality data. Now, some practices have already started this scheme and others have not. So I'm just going to explain what it entails. So the two areas of focus is consultation types and staff job roles and wider determinants of health. So consultation types and job roles. So as you know, there is a lot of variation between practices when it comes to using consultation types and setting up staff job roles. So the standardizing of this data will allow practices to understand their activity and workload and help practices to understand their overall demand and capacity. And it will help you to identify areas where extra resources may be needed. For wider determinants of health, so Tower Hamlets practices have already been recording this data for LTC patients for some time, but the data accreditation scheme focuses on newly registered patients. So those are patients registered since October 2023 and patients who live in the most deprived neighbourhoods. So as you know, wider determinants of health are linked with health inequalities, and capturing this data can help practices improve the care of those patients most at risk of poor health outcomes. And you can do this by facilitating targeted support and intervention. So there is also a support search for this, and it's the wider determinants of health support search that practices can use. So there are 3 different phases to this scheme. So phase 1, you'll need to sign up to Edenbridge Apex, and then you will need to send evidence to me of your updated consultation types and your updated staff job roles. Phase 2, which is the wider determinants of health part. There's 2 parts to this. Part 1, you'll need to make sure that you are recording the ethnicity, language, communication and contact preferences, and carer status for the eligible cohort, and you need to reach target of between 95% to 100%. For part 2 is the actual wider determinants of health questions. So that's your social isolation, health literacy vulnerability, housing and income vulnerability. And you need to hit a target between 25% to 95%. And then phase 3, which entails an accreditation visit at the end of the year. So you'll need to make sure all system requirements are in place. So this means ensuring that phase 1 and 2 are embedded in your practice now and going forward. All required training is done. So this is training for the Apex Edenbridge software. And to qualify for the phase 3 visit, you'll need to have achieved at least 25% for phase 2, part 2. You can still carry on with phase 2 and try to achieve a higher target, but 25% is what you'll need for the phase 3 visit. The payment is tiered, so the higher the target you achieve, the more payment a practice will receive. And also, there is payment for each phase. So for instance, if you have done phase 1, you'll get an invoice for payment as soon as you complete it and it's been checked. So if you've not already signed up to this scheme and you do want to, please contact me. I will be happy to meet with you and go over this in more detail and help you achieve your target. Are there any questions? Okay, are there any questions in the chat?
So there was one around what do you mean about by evidence, which we've responded to in the chat.
Okay.
Ashdor has just said, is this part of our CAP objectives?
CAP objectives. I'm not
Ash,
sure what that is.
yeah, I was gonna say, Ash, do you want to clarify what? Capacity and access plan.
No, I'm not. I don't believe
No,
so.
it's not.
This
This is sorry, Toyin. No, this is
yeah.
this is a separate Liz.
Scheme.
That's a nail-wide Liz. It will, by updating your consultation role types, it will highlight exactly how much work is being done by different parts of the surgery. But it doesn't actually have an impact on capacity and access.
Ah, right.
Carol has said, looking at Edenbridge Apex now, can't see the bit where it says roles.
Oh, this is so you will be updating your staff roles, making sure that each of your staff is in the proper category on EMIS, not on Apex. Does that answer your question?
That's in the appointment book then.
No, that's in organization configuration. I'll be happy to show you exactly what you need to do. If you just drop me an email, we can meet and I can show you exactly what you need to do. There is also a fact file, and we have a link for that in one of the slides later on in the presentation.
No more questions, Toyin.
Okay. So we're going to move on to what the CEG can offer. So as I said earlier in the presentation, I'm just going to speak briefly about the other Apple tools that we have. So we've got the Apple IMS tool, which is the child IMS call and recall tool. So its purpose is to allow practices to view children's incomplete or overdue immunizations, and it helps practices to better handle their call and recall system. We've got the cancer diagnosis audit tool, and this helps practices review their processes around suspected cancer referrals that lead to a confirmed diagnosis. And you can also use this for your early diagnosis of cancer devs. And then we have the Apple NDPP tool. So this tool makes it easy to view a list of eligible patients who are at risk of diabetes and refer them to the National Diabetes Prevention Program. And then we have our Apple AF tool, which helps clinicians to review AF patients, make sure that they are on the most effective and safest medication. And I've put the link under each of them to the online request form, which will allow you to download them. We also provide you with many support searches, which you can find in the CEG population and reporting domain. So in the ICB contract folder, for instance, you have support searches for asthma plans and reviews, your ADHD adult reviews, integrated care support, and your ICCQ enablers, wider determinants and substance misuse. There's a public health folder where you will find latent TB screening, support searches, NHS health check searches, and your sexual health and LARC support searches. There is a PCN contracts folder. So in there, you've got your IIF guidance support searches, SMI physical health check, care home, supplementary service, and structured medication reviews as well. Okay, we also provide you with templates for easy recording of data and codes. So some of these templates should be familiar to you. So one of the most common templates you're likely to use is the LTC review template, which will help you to record codes and data for your local enhanced services and QoF. There's also the health check template for NHS health checks and latent TB, or the women's health template for your cervical screening and LARC. And there's a few other templates as well that I'm sure you're familiar with. We also offer dashboards. So this is a picture of our website. So this is a hidden URL on our website, but if you want access to it, because you will need a username and password, just get in contact with me and I will email those over to you. So you just have an example of our integrated care dashboard and our childhood immunizations dashboard as well. We also offer practice visits and one-to-one support. So that can be in person or virtually. So in our practice visits, we can check that you're using the most up-to-date searches and templates. We can set up and demonstrate the use of our software tools. So for instance, our Apple tools. And we also give support with service performance and delivery. And you can also contact us via email if you have any questions or queries. We produce a weekly CEG e-bulletin. So this includes useful information about any updates that we make for templates, searches, documents, etc. If you don't already receive this bulletin and you would like to sign up, you can do so via the link on the slide by submitting the online sign-up form. Or you can just email me and I will put you on our mailing list. Just want to mention about CEG and PCNs. So we sent out sharing agreements to PCNs so that they'll have access to many of the templates and documents that is used for the ICB and public health services. And so there is now a dialogue between the CEG and the PCN. I just want to make you aware that without enterprise search and reporting, searches will not work. But if you do have that, then you can also use some of our searches. This is just a list of some of our CEG resources that you might find useful. So there is the data accreditation scheme link there, and a link to more information about our software tools, and a link to our dashboard. But as I said before, it does require a username and password to log in. So if you would like to have a look at our dashboards, please just get in contact with me and I'll give you the login for it. And here is our contact details. And as I said again, if you do have any questions or queries, please just email me and we'll get back to you.